Hi everyone, welcome back to my YouTube channel. Today we are going to talk about metaplasia, and here at the side you can see the diagrammatic representation of normal epithelium, squamous metaplasia and dysplasia or anaplasia. So let's start our topic with introduction. Human body is made up of tissues that are highly specialized to perform specific functions. Sometimes under stress or abnormal stimuli, cells may undergo adaptive changes to survive in their altered environment. One such adaptive change is metaplasia, in which one type of mature differentiated cell is replaced by another type that is better suited to withstand a particular stress. Although this process is initially protective, it can become harmful if the stimulus persists. Definition of metaplasia. Metaplasia is defined as a reversible transformation of one type of differentiated and mature cell into another type of same germ layer cell. It is not a change in cell number like hyperplasia or change in cell size like hypertrophy, but rather a change in cell type. This transformation is usually a response to chronic irritation or inflammation. Types of metaplasia. Metaplasia can be classified into two main types. First is epithelial metaplasia and second type is mesenchymal metaplasia. First type is epithelial metaplasia. This is the most common form and involves changes in the epithelial lining of organ or surfaces. Their examples include squamous metaplasia, that is replacement of columnar epithelium with stratified squamous epithelium. It is commonly seen in respiratory tract of smokers where normal ciliated columnar cells are replaced by squamous cells. And the other type of epithelial metaplasia is glandular metaplasia, also known as columnar metaplasia. It is replacement of squamous epithelium with columnar epithelium. It is seen in Barrett's esophagus, where the squamous lining of the esophagus is replaced by intestinal type columnar epithelium due to acid reflux. Next type of metaplasia is mesenchymal metaplasia. This is less common and involves changes in the type of connective tissue. For example, fibrous tissue in the area of injury may become bone or cartilage, that is called as osseous metaplasia or cartilaginous metaplasia, depending on the end type of the tissue that is formed. Mechanism of metaplasia. Metaplasia does not result from a direct conversion of one mature cell into another mature cell, but rather from the reprogramming of stem cells or undifferentiated precursor cells in the tissue. This stem cell then differentiate along a new pathway in response to chronic environmental stress or injury. This process is driven by signals such as growth factor, cytokines, inflammatory mediator, and extracellular matrix changes may be the cause of metaplasia. When the stress is removed, metaplastic changes can be reversible. However, if the stimulus persists, metaplasia epithelium may become dysplastic and may eventually progress to cancer. Causes of metaplasia. Metaplasia usually occur in response to chronic physical or chemical irritation. Some common causes include cigarette smoking that causes squamous metaplasia in the respiratory epithelium, gastroesophageal reflux disease that leads to Barrett's esophagus, that is intestinal metaplasia, vitamin A deficiency that can induce squamous metaplasia in various epithelial tissue, chronic infections such as schistostomatosis causing squamous metaplasia in the urinary bladder, mechanical trauma or persistent inflammation that can trigger in connective tissue metaplasia. Examples of metaplasia. First example is respiratory tract. In smokers, the normal pseudostratified columnar epithelium of the bronchi is replaced with stratified squamous epithelium. Although squamous cells are more resistant to injury, they lose important functions such as mucus secretion and ciliary movement. Second example of metaplasia is Barrett's esophagus. In people with chronic acid reflux, the squamous lining of the lower esophagus is replaced with intestinal type columnar epithelium, which is more resistant to acid but has a higher risk of transforming into the adenocarcinoma. Next example of metaplasia is cervix. Chronic inflammation or hormonal changes can lead to squamous metaplasia of endocervical columnar epithelium. Next example is urinary bladder. Chronic irritation due to infection or stone can cause transitional epithelium to undergo squamous metaplasia. Significance of metaplasia. First, it is a protective mechanism. Initially, metaplasia is an adaptive and protective response to chronic stress or injury. The new cell type is often more resistant to the adverse environment. Second significance is loss of normal function. Although the new cells may be more durable, they often lack the specialized function of original cells. For example, squamous epithelium in the airway cannot secrete mucus or clear particles effectively. Third significance is risk of malignancy, as persistent metaplasia may lead to dysplasia, that is disordered cell growth, and eventually it can lead to neoplasia, that is cancer, especially if the injurious stimulus is not removed. For instance, where esophagus can lead to esophagus adenocarcinoma. Reversibility of metaplasia. Metaplasia is generally considered a reversible process, especially when the underlying cause is eliminated. However, long-term metaplasia that progress to dysplasia and cancer become irreversible and pathologic. Diagnosis of metaplasia. Metaplasia is typically diagnosed through histopathological examination of tissue biopsies. Microscopic examination can reveal the abnormal changes in cell type. In some cases, imaging and clinical symptoms guide the need for biopsy and further analysis. Prevention and management of metaplasia. First, avoidance of irritants. By smoking cessation, reducing acid reflux, and treating infection, it can prevent metaplasia. Second, regular monitoring. Individuals with conditions like bad esophagus may need regular endoscopic surveillance for proper monitoring of the tissue. Third, early treatment. Addressing inflammation or hormonal imbalances early can prevent progression of metaplasia. Conclusion of this lecture video. Metaplasia is an adaptive cellular response to chronic stress, irritation, or injury. While initially protective, it may compromise tissue function and potentially lead to cancer if the stress continues. Recognizing metaplastic changes through clinical observation and biopsy is important for preventing further pathological progression. Maintaining tissue health by avoiding long-term irritant and treating underlying conditions is essential to preventing metaplasia and its complication. And this was all about metaplasia. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.